Well, good afternoon. Friends, we're facing a very, very serious situation. As I've said many times, we will do whatever it takes to protect the people of Ontario. And as Premier, it falls on me. I'm the one who has to make the tough decisions. Today, I need to make one of those tough decisions. Effective Saturday, April the 3rd, at 12:01 a.m., Ontario will pull the emergency brake for the entire province. All 34 public health regions will move into shutdown for a period of 4 weeks. Friends, right now, we're into a third wave of COVID-19. The variants of concern are spreading rapidly. This is a new pandemic. We're now fighting a new enemy. The new variants are far more dangerous than before. They spread faster, and they do more harm than the virus we were fighting last year. Younger people are ending up in the hospital. And with these new variants, the risk of ICU admissions is 2 times higher. The risk of death is 1.5 times higher. And today, we have 2,557 confirmed new cases of COVID-19 in the province. We're now seeing a nearly 14% increase in hospitalizations, with COVID-19 patients in ICU increasing dramatically. In fact, we've never had more Ontarians in intensive care than we do today. We're working around the clock to build out our hospital capacity. We've added 3,100 new hospital beds since the start of this pandemic. Cortellucci Vaughan Hospital has been providing pandemic overflow for months now. Right now, we're dedicating an additional 70 beds at the Toronto Congress Centre. These new beds will help more alternate level of care patients out of hospital so we can free beds for COVID patients. And our vaccination rollout plan is well underway. We're making steady progress. To date, 2.3 million vaccines have been administered in Ontario. We have more pharmacies, primary care settings, and mobile clinics coming online every day. In fact, just this morning, a large shipment of AstraZeneca vaccines landed in Ontario. And we announced another 350 pharmacies will offer vaccines across the province starting on Saturday. This brings our total to over 700 pharmacies offering vaccines, and we're ready to ramp up to 1,500 once we have more vaccines. And right now, the millions of additional vaccines we need, they're on the horizon. They're weeks away. We know that they're coming in mass amounts starting soon. And that's how we know that things will get better very, very soon. But the bottom line is that we need more time. We need to close the gap between where we are today and where we will be with the millions of vaccines we're expecting by June. We need more time for our vaccine program to take hold. But we are in a desperate race right now against an extremely, extremely aggressive and fast-moving virus. We need more runway to allow our vaccination rollout to get where we need it. And that means we need to take action now. And it's important to understand that this situation is not unique to Ontario. We're seeing provinces across the country and also many states face the same challenges. They're all dealing with the effects of a third wave and in dangerous new variants. So please understand, this decision was not made lightly. I know the toll these restrictions continue to take on people's mental health and well-being. And please understand, folks, this decision weighs extremely heavy on me. I know what this means for people to be here over a year into this pandemic. It's frustrating and it's very, very difficult. But we've come so far. We have sacrificed too much to throw in the towel so close to things getting better. And let's be clear, the cost of inaction is simply too high. We know for a fact that the stay-at-home order, the restrictions we have introduced thus far, have saved thousands of lives. But I know what this means for businesses and people who continue to sacrifice. And you have my word. We will be there for you, and we will have your back. Ontario Small Business Support Grants, which provides up to $20,000 to help eligible small businesses, remains open. During the difficult period, we've extended the deadline for applications through April 7th, and I strongly urge all eligible businesses to apply. And right now, we're providing another $1.7 billion. We will get through this, and we will get our businesses back on their feet. I also want to take a moment to talk about our schools. We're doing everything we can to keep our kids in class. This is a top priority. We have made historic investments and introduced the strongest school safety plan in the entire country. But as always, we will closely monitor in your families. And as I stand here, we're only hours away from the Easter long weekend. I want everyone to know that there's some activities permitted with safety measures in place. Indoor religious services will be allowed at 15% capacity. But we must, and I emphasize this, we must all avoid social gatherings. I know many of you were hoping to celebrate this important holiday with family and friends. But again, I'm asking everyone to only gather with your immediate household. Because, my friends, I want us to have a good summer. And these steps, the next 4 weeks, are our best chance to save lives and to make sure this summer we can get things open and get back to our lives. We will get through this if we all work together. And I can assure you, brighter days are on the horizon. Thank you, and God bless the people of Ontario.
This deadly virus. But the modeling has shown us that we must be nimble in applying public health measures to reduce the risk of transmission in our communities. It's even more important now when every vaccine administered represents one step closer to an end to the pandemic. Across the province, we are continuing to vaccinate tens of thousands of people every day, and we will use this shutdown period to vaccinate even more Ontarians, of course, pending supply. Until then, we are asking everyone to please continue to follow all public health measures and advice, including limiting trips outside your home to essential purposes only and allowing employees to work from the safety of their homes. We've bent the curve before, and we can do it again. And recent modeling showed us that there is reason to be optimistic for a summer we can all enjoy. But it will take a collective effort from all of us. So thank you for doing your part to stop the spread of this deadly virus and keep our communities safe. Thank you.
We'll go to the phone line for questions. First question, please.
From Jeff Gray at the Globe and Mail.
Hi, Jeff.
Oh, hi. Thanks very much. I wanted just to ask for some clarity, I guess, about the measures that are referenced in Dr. Brown and the Science Table's modeling today. They talk about a stay-at-home order. The language you're using today, it doesn't sound like this is the equivalent of a stay-at-home order. Can you explain the difference, why you're not going ahead with that kind of order?
I'll pass that over to Minister Elliott. Thank you.
We are not going to be producing a stay-at-home order because we saw that last time that it had tremendous ill effect on both children and adults. And especially with the warmer weather coming, We want people to be able to go outside and enjoy the outdoors, assuming that everyone continues to follow the public health safety precautions. What we are introducing is an emergency brake shutdown that allows some activities to be carried out, but the lockdown, we know with the warmer weather coming, with all that we've asked Ontarians to sacrifice, is too difficult to do. And we also, of course, have to balance any measures that we take with people's mental health as well. So that's why we chose the emergency brake shutdown rather than the lockdown.
Follow-up?
It does seem, though, that in hotspots like Toronto and Peel, there are very few changes then to the activities that people are allowed to do or not to do. And I wonder, is it possible that these small changes, I mean, it looks like patios is the only major one, will actually cause any reduction in caseloads in those areas which are already in trouble? And I wonder maybe if Dr. Brown could comment about the difference here between these two ideas.
Sure, I'll pass it over to Dr. Brown, but before I do, I just want to remind everyone, we have the toughest restrictions in North America. We have the toughest restrictions in Canada right now, and we're throwing everything at this virus. And I'll pass it to Dr. Brown.
Thanks. The modelling we presented was based on the experience, the reduction in cases that we saw in Ontario with the lockdown and the stay-at-home that we saw after the winter holidays. We try to use historical examples to be able to ground these estimates in the models. It would be hard for me to say right now what the difference will be between this emergency brake order and the effect of the order after Christmas.
Next question.
From Mike Crawley at CBC. Please go ahead.
How you doing, Mike?
Hi, Premier. What is the strongest restriction in this emergency brake shutdown that is actually different from the lockdown? And how is that going to have any impact on cases? What are the significant differences in this emergency brake shutdown that are going to have any significant protective effect over what already exists in lockdown?
Well, thanks for the question, Mike. First of all, it's province-wide, and we've seen as the variants in the virus spread all over, no matter if it's Sudbury, up to Thunder Bay, down in London. We see it spreading at a rapid pace. So it's a complete shutdown of the entire province. We also see, the people gathering in large groups that were totally discouraging. We saw what happened in the last holiday season. It took off, so we're discouraging that. Outdoor dining, I can tell you, it kills me to cut off the outdoor dining. It does. I'm getting calls, my phone's blowing up, and my heart breaks for these people. And that's why we're putting the $40,000 to a total of $40,000 grants. We've extended that till April 7th to help bridge the restaurants over till the end of the 4-week period. But we could put all the restrictions in the world, Mike. We need the help of the people too. I know it's difficult last year. It's painful for everyone, and it's hurt a lot of people. But we have to do it. I am convinced 100%, not even a question in my mind, if we don't do it, we'd be in deep, deep trouble. We'd see the ICUs get out of control. We'd see the deaths get out of control. We're finally getting our arms around the mortality rates and long-term care, and thank God for that. And now what we're seeing is younger people ending up in ICU and in some cases passing away, which is terrible. So we need to do this. I know there's a lot of people that just want to go out there and open up, and no, they don't believe this variant can be passed. I'm sorry. I'm a business person. I want to open up patios, but we just can't. We just can't. We went We went for 8 or 9 hours till midnight last night on a caucus cabinet call. And there's debate, a lot of debate. But I told them if we want to see, the summer and be able to have, a chance to get out there if we receive the millions of vaccines that we expect, then we have to do it. We have to crunch down one more time for 4 weeks. It's a sacrifice that we have to take.
Follow up?
Premier, if the restrictions that have been in place in the lockdown zones for so long have not slowed the spread of the virus in places like Toronto and Peel, how is closing outdoor dining on patios going to make one iota of difference in slowing the spread of the virus?
Well, before I pass it to Dr. Williams, we saw when last time we did a shutdown, we saw the numbers drop below 1,000. And when we dropped below 1,000, local medical officers, mayors, all mayors, were saying we need to open up safely and gradually, which we did. And then these variants, got into our country, and they're running wild right now. But I'll pass it over to Dr. Williams.
Well, I think what you have to look at is that this is a process that we've been undertaking for the last 4 to 5 weeks. Each week we look at the data, we move up health units in the framework to more restriction. We went from the 2 in the lockdown to 5. We were planning to move to 2 more again as the numbers increase. So this has been a graduating process. With Toronto and Peel, we had kept them in the lockdown for the long period. We had discussed with the local medical officer of health. We've seen that their numbers have stayed lower than was anticipated because of the outbreaks. Back 2 weeks ago, Dr. Brown said if we didn't do anything, we would be around 4,000 to 4,900 cases a day at this time. We're not there. Nevertheless, I'd like to be even lower again. And it's not a lot of that is that we've kept the numbers down from climbing as high as they could in Toronto and Peel. We went with their suggestion of opening up indoor dining to some extent and patios and looked at that, getting ready to open up personal service settings in another week or so with very much reluctance and not sure what would happen. But now that course has stopped and we're not going that way. So the big issue we're hearing around the province is that other ones outside are finding that people from the high areas of lockdown are going out to the other areas, and we're seeing that spread, that all of a sudden areas that were very quiet for a long time are blowing up with cases as people from the high-risk areas go out and obtain services and things and not adhering to the stay local, stay around your own area and not go out. So we want to emphasize that. That's one reason for going, as the Premier said, province-wide with the same standard, the same restrictions to protect, not only deal with keep numbers down in Toronto and Peel, but to make sure they don't get out to the other areas. Even if you're green or yellow, you can go up to red and lock down very fast. We've seen it happen. Our lockdowns have worked. We locked down in Thunder Bay. They're coming down. We locked down in Sudbury, and their numbers are plateauing and starting to come down. Same as Lambton, starting to plateau. So the lockdowns do work in that area there. They bring numbers down, but they also keep numbers down. And that's been a very strong strength of ours in Toronto and Peel for the last 3 to 4 months, or it could have gone and really imploded extensively and kept them down. Is it still going up? Yes, and we still have our work ahead of us. So I would say that the difference is going back to what was working before and staying at that, but keeping everybody at the same level.
Next question.
From Colin DeMello at CTV News. Please go ahead.
Hi, Colin.
Hi, good afternoon, Premier. Just on the flip side of all of this, hair salons, gyms, restaurants have been closed in Toronto and Peel since November, yet the infection rates continue to go up. We've seen outbreaks in warehousing and manufacturing, yet they are allowed to stay open. So why is your government consistently targeting those small business owners with restrictions, the hair salons and gyms and restaurants, when there's no evidence of transmission in these places over the last 4 months?
Well, I'll pass that back to Dr. Brown, but in businesses we're deploying, we've deployed in schools and long-term care over 3 million rapid tests, and we want to increase that. But I'll pass it back to Dr. Brown. I'm sorry, Dr. Williams. I apologize.
Well, to be correct, we have and we are seeing outbreaks in those settings. They're not so much in places like Toronto and Peel because they're closed. And we have seen some others occurring. Why in those settings there is because they're going to be in very close contact with someone closer than 6 feet for an extended period of time. And we are worried about transmission there. We have seen it happen in similar settings in and around there. It brings people out. And of course, we're mostly concerned, as Minister Elliot's alluded to, for people's well-being. There are essential things they need to get out and do. We understand that. But still with checks and balances, masking, distancing, trying to adhere to all those things as meticulously as possible. So we have limited those ones. We have now outbreaks in restaurants, in other areas that had them opened. And so just because they're closed and you don't see outbreaks doesn't mean they can't occur in ones that have opened. They have occurred, and unfortunately they've affected not just the patrons, they've affected the staff. And we're very concerned about that because a lot of the staff are, of course, with the concern of the variants, are under the age of 50, and we're very concerned about their health and making sure they do not succumb to the consequences of the variants at this time. So we have to remain strict on that.
Follow-up?
Okay, I don't quite understand that, but thank you. Premier Ford, back to you. On vaccinations, is it fair that frontline healthcare workers who are taking direct care of COVID-19 patients should have to wait 4 months for their second dose of the vaccine, or should they be eligible to receive that second dose sooner so they are fully protected against the virus while working in a high-risk environment?
Yeah, before I pass it over to the Minister of Health, I've talked to many CEOs, and one of their big concerns are the frontline healthcare workers, not the docs, but we just aren't seeing the take-up on getting vaccinated with the first shot. So that's very, very concerning. So I encourage any frontline healthcare worker, please get vaccinated, and I'll pass the balance over to the minister.
Well, thank you. This issue has been extensively studied by Health Canada, by NACI, by Dr. Williams and his colleagues, and the conclusion has been made that the 4-month interval is safe, that you receive tremendous protection from the first vaccine, and that it is all right to receive the second vaccine within the 4 months. We expect that with the supply of vaccines that we will be receiving in the next short while, though it won't be a 4-month period, but will be shorter than that. There are some limited exceptions for that, people who have received transplants, people with certain types of cancer and others, but for the most part, that 4-month interval is safe for virtually everyone.
Next question.
From Cynthia Modigan at City News. Please go ahead.
Hi, Cynthia.
Hi, Premier.
Hi.
I have to ask, we've been hearing that wave 3 is going to be worse than the prior waves for weeks. We've been slowly watching this unfold with warnings from doctors and the Hospital Association. Why are you only taking this action now when in the last few weeks you've been actually moving to open up a little bit more despite the warnings about the third wave being more deadly and more contagious?
Well, Cynthia, thanks for the question. As I answered earlier on, we thought at the time there was under 1,000 cases, and again, with consultation with our chief medical officer and the local medical officers and all the mayors, every single one of them were saying we needed to open up. And we thought we were going to get a lot more vaccines and so on and so forth. But it comes down to a combination of things. Right now, we need people to be vigilant. And, a lot of people let their guards down. And I think, you walk down the street in your area and the patios were packed. And all of a sudden this variant took place and the virus took off. But in saying all that, Cynthia, we still have the toughest restrictions anywhere in North America, bar none. So we're doing everything we can. And to say, just lock people down for undetermined time is just, it's not good for people's mental health. They needed to get out. They needed fresh air. And we just have to get through the next 4 weeks. I know we're going to get millions of vaccines, and I want to thank the federal government. I know I've been tough on them, but I want to thank them. When they're delivering whack of it today, the AstraZeneca, because we were down to 0 AstraZeneca. I think yesterday they had 100 left because of the due date, but they're gone as of this morning. And now a shipment came in, so that's great. We're getting more Modernas coming in. We're getting more Pfizers in. So that's encouraging news. And now we can start ramping up this 700 pharmacies and start just cranking up. Even 700 pharmacies, we're still at 25% capacity at pharmacies. But in saying that, they're doing well.
Follow-up?
Okay, Premier, my next question is about the modeling this morning. The states very clearly the vaccinations are not reaching the higher risk communities. Are there major flaws in Ontario's vaccination? Does it need to be to reach the people that need the vaccines the most? For example, to your point, people 55 and up can now get vaccinated in pharmacies, but we know some 55-year-olds and up are at greater risk than others. Why aren't we taking those vaccines and sending to the people that need them the most, like the essential care workers?
Yeah, before I pass to the Minister of Health, every day I get briefed numerous times, and we need to work with large regions like Toronto, and they're doing a fabulous job. They really are, and it's very difficult, but they're putting mobile units into these hot areas. We really need to target it. I'm kind of shocked to see how many 70-year-olds haven't signed up, and outside of literally door knocking and getting them or mobile units going to neighborhoods, which we're doing, and we're going to be there to support them. And there's still a whole bunch of 80 plus haven't signed up, so we're going into those neighborhoods and literally going into condos, and we'll be door knocking. So it's it's a challenge to get people out there, as you've heard from Mayor Tory. We're now lowering the age down to 60 for Toronto and Peel, but there's still in Peel and Toronto a ton of 70-year-olds and even 80 plus that we have to get vaccinated. But at least this will allow them to not have empty seats. I'll pass it over to the Minister of Health.
Well, thank you. We have one vaccination plan that is being delivered by the 34 public health unit regions, each in their own way, depending on their own geography, knowing their own circumstances in their own area, and making the access as available as possible to any person in Ontario who wants to receive the vaccine. So some of that is being done by large vaccination clinics. It's also being done by pharmacies now. There are 3 in each public health unit region that will be available to provide vaccines, in primary care offices as well, but also in other areas and in mobile uses and in community clinics. We have reached out extensively through our community and vaccine task force to reach some of our community partners that are dealing with some of our populations that are more difficult to reach, whether it's by reason of their inability to get to a mass vaccination clinic, language difficulty, vaccine hesitancy, or whatever the case may be. And so we are working with our community partners to bring the vaccines to where people are in more circumstances rather than asking them to come to us, because we want the access to be as easy as possible so that as many people as possible who wish, of course, to receive the vaccine will be able to receive the vaccine. So that is something that we have always provided for in our vaccination plan, and we are rolling that out now. I certainly can advise that we now have our community paramedics also going to visit residents of Ontario who are bedridden or homebound, who are not going to be able to go out to receive the vaccine. We are bringing the vaccine to them.
Last question.
From Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hello, Premier. I'm going to have a go at a question some other reporters were asking earlier. What we can't figure out is, so we've got the rest of the province now adopting measures that haven't really worked in Toronto and Peel. So can someone there, maybe Dr. Williams, explain why they don't seem to work in Toronto and Peel, but they've worked in Sudbury, Thunder Bay, and Lambton? That's what people can't get their head around.
Yeah, well, and before I pass it, Dr. Williams, it's just my personal opinion driving around. You know, a lot of people are gathering in larger groups. And at a point, Rob, when we did put the restrictions before, we did see it drop. We did see it go below 1,000. And I believe that if everyone just goes by the guidelines and the protocols laid out by the chief medical officer, we will see the numbers drop. We have no choice, but you know, it really comes down to each and every one of us to follow those protocols. And I also believe, and obviously the vaccines don't take effect overnight, they take a while, but as we're getting more vaccines, we're going to see the numbers drop, just like we see in the older age groups. Now we're seeing a spike in the younger age group, and I just ask the young people, please, you aren't invincible. These you're now close to, 46% of ICU patients are in the younger age groups. That's heartbreaking. Imagine when your kids or anyone's kids sitting there in ICU, a young healthy person, just because they felt they were invincible. That's terrible. So we have to do everything we can to make sure people's habits change. They don't let their guard down. We have 4 weeks to hopefully turn this around. And you're talking about 2 regions, one very large region, Toronto, another massive region, Peel. So that's my opinion, but I'll pass it over to Dr. Williams.
Well, I think, Rob, if you look at the data, and to say that it hasn't worked in Toronto and Peel, it has. Back, if you look at the chart, even what Dr. Brown showed you, you'll see that while Thunder Bay went up to 158 cases per 100,000, Peel was well over 230 back in January, and Toronto was close to that. They brought those down. They have not come out of the lockdown, so it's kept the numbers down. Some smaller places have seen their numbers and their rates go up by 30 to 40% every 5 to 6 days. If we saw that in Toronto and Peel, we'd be posting 2,000 to 3,000 cases each. We're not seeing that. So I would disagree. The lockdown has worked, and I know that doctors Davila and Lowell felt that and knew they were very concerned about lifting and what might happen to their numbers as they have with other health units out and around that have experienced the same surge with the variants of concern. So in a sense, I'm saying the lockdown has worked in Toronto and Peel, has kept things contained. If they didn't, we'd be far off. It would be worse by far with a doubling of the numbers every 7 to 10 days, which we have not seen, we do not want to see.
Follow-up?
I think my point was the question that, while it has brought cases down, they are rapidly rising. So that leads me into the next question. Have we seen what we've seen in the last 10 days, 2 weeks, because of patios being open? And did opening patios send a wrong signal? Did the increase in outside of lockdown zones and allowing more people to do indoor dining, did that play a role in this? And was that also a wrong signal, along with telling people last weekend that they'd probably be able to get haircuts on April 12th, which of course is not going to happen now?
Yeah. Well, first of all, if we break this down per region, Rob, you're looking at 3 regions, York, which is doing a great job, but York, so is Peel and Toronto, those 3 regions that represent approximately 40%. The population represents 60% of all cases. And we really have to focus on those areas. And as I think it was Cynthia or someone else that asked, we really have to focus on those high priority areas that we see the spike there. And we're encouraging people in those high priority neighborhoods, and I represent one of them up in Rexdale, to get out there and please get vaccinated. And we'll have more opportunities as we expand the pharmacies. But I'll pass this over to the Minister of Health there.
Well, we do want to see more people be vaccinated. That gives us that greater protection. And really where we were before is where we were, where we want to be. We've moved quite far along that. So right now what we need to do is to bridge that gap, to get to the point where we will have sufficient number of people vaccinated that we will be able and bring the numbers down so that we can hopefully return more to a summer that we can all enjoy. But we're not quite there yet. We need this additional time with this shutdown in order to get the numbers down, to get more vaccines into people's arms. And now with the notice of the delivery of the AstraZeneca vaccine, the Moderna vaccine coming, and additional Pfizer vaccines, we will have the quantities that we need in order to do those mass vaccinations that will get us to where we need so that we will have that herd immunity for the protection of everyone in the province.
Thanks, everyone.
Thank you, everyone. Happy Easter.